Hello, and welcome to the Healthy Life Self-Care and Use Seminar. I'm Dr. Don Powell, President and CEO of the American Institute for Preventive Medicine. Since 1983, the Institute has been a leading provider of health promotion and self-care programs and publications to over 12,000 organizations. We've also been honored by the Centers for Disease Control and Prevention and the President's Council on Physical Fitness and Sports. I want to introduce Steve Byers, a Vice President here at the Institute, who will take you through the seminar.
How to use your self-care guide is to know how to decide when it is appropriate to seek medical care and or use self-care. To help illustrate this, look in the table of contents of your self-care guide for the section titled Common Health Problems. Go to the first page of that section. Depending on the self-care guide you have, common health problems are listed in order from A to Z or are put into chapters with similar problems such as eye conditions, ear, nose, and throat problems, skin conditions, men's health issues, women's health issues, and so on. Information for each topic in the Common Health Problems section is divided into parts. 1. Facts about the problem, what it is and signs, symptoms, causes, and treatment for it. 2. Yes or no questions to help you decide if you should get medical care fast, see your doctor, call your doctor, or use self-care. And 3, a list of self-care and prevention tips to deal with the problem. For example, find the page for the sore throats topic and turn to that page. You will see information about sore throats under these headings: signs and symptoms, causes, treatment, and self-care and prevention. Look now at the questions to ask. Answering yes or no to these questions will help you decide whether it is appropriate to get medical care or to use self-care. It is very important to understand what the instructions and the symbols that go with them mean. If your self-care guide is titled Health at Home Lifetime, there will not be a questions to ask section. Instead, symptoms will be listed under each heading.
Hello, I'm Dr. Susan Schooley. I'm the chair of the Department of Family Medicine in the Henry Ford Health System. I'm also the medical director for the American Institute of Preventive Medicine, and I'm here to help you learn how to use your self-care guide. Get medical care fast means the problem could be a medical emergency. A medical emergency could result in death or serious harm if you don't get prompt care. For conditions that could threaten life, get to the nearest hospital emergency room or call 911 or your local EMS. Signs and symptoms for these are listed in the Emergencies and First Aid section of your self-care guide. Talking about getting emergency medical care reminds me of a letter we received from the wife of a husband who was having chest pain. Here's what she wrote.
My husband initially ignored the chest pain, but after I read my self-care book, I insisted he go to the emergency room. At the ER, he was diagnosed with having a heart attack. Surgery was performed within an hour. Had my husband not received immediate treatment, he would not be alive today. I credit my self-care guide with saving him.
Mary Jo Parsons, a pharmacy supervisor at Aurora Medical Center, is grateful for the Healthier at Home self-care guide that she received from her employer as part of its wellness program. She thinks it may have saved her husband's life.
My husband Jay felt unusual back pain after laying flooring in our garage. For relief, he took an Advil and a hot bath. Unable to sleep that evening, Jay noticed pain in his left shoulder and elbow. He got up, sat in the recliner, and felt better. On our coffee table was a copy of the Healthier at Home. As I sat up with my husband, I paged through the guide. On page 387, I noticed Jay's symptoms matched those of a heart attack. Using the self-care first aid section of the guide, I knew exactly what to do. I told him to take an aspirin and we'll go to the emergency room. It was a real lifesaver.
The reality is that the book itself did not save her husband's life, but reading it and following the advice given helped him get the appropriate level of care. Get medical care fast can also indicate conditions that do not threaten life, but need medical care or evaluation right away. For these, go to an urgent care center or call your doctor without delay. See doctor means the problem may need medical care, but not right away. A doctor may need to diagnose the problem. It may require medication or professional treatment so that it doesn't get worse or result in more serious problems. When we say doctor, that could mean your primary care physician, either a private physician or through your HMO. It could be your gynecologist or obstetrician for women, a walk-in clinic or an urgent care center, a physician's assistant or nurse practitioner, a certified nurse who works with your doctor. It could be a home health care provider, or even could be your dentist when appropriate. Obviously, if you have a primary care doctor or personal physician, you will need to call him or her first to request to be seen. Explain your signs and symptoms to the doctor's office assistant. If your doctor or healthcare provider cannot see you soon, ask where else you can go to be seen. If you do not have a personal physician, you may need to seek the advice of a healthcare provider at a walk-in clinic or call a local physician referral service. Check with your health insurance carrier for services and facilities that are covered by your health plan. See counselor or call counselor means to contact a mental health care provider. This could include your counselor or therapist if you already have one. It could be a mental health professional at your employee assistance program at your job. Many EAPs have mental health professionals who do brief treatment. It could also be a mental health center where a psychologist or social worker or any other healthcare provider in the mental health field, such as a psychiatric nurse, might be able to help. If you belong to a health maintenance organization or other managed healthcare plan, you may need to call your primary care physician for a referral to a counselor or other healthcare provider, including a psychiatrist. Also, a counselor may suggest that you join a self-help or support group. Call doctor indicates a less urgent situation, but one that your doctor really ought to know about. Depending on your medical history and current symptoms, your doctor may decide that you need to be seen or could send you to a facility for testing or prescribing treatment over the telephone or give you specific instructions to treat the problem. You won't know until you call. Let's look at a topic where these symbols are used. We'll use the questions to ask section for sore throats. Turn to that page again. Your answers to the questions point to the appropriate level of care you need for the signs and symptoms you have. Start with the first question. If you answered yes to the first question, you should get medical care fast because symptoms indicate a possible emergency. If you answered no, read the next question. If you answered yes to this question, you should see your doctor because symptoms suggest a problem that could require prescribed medicine to treat the sore throat. If you answered no, read the next question. If you answered yes to any of the questions within this set of questions, call your doctor for advice. You may need to make an appointment to be seen to diagnose the cause of the sore throat and get the appropriate treatment for it. If you answered no, you are directed to use self-care. Use self-care means you can probably treat the condition yourself. Use the suggested self-care tips in your guide. If after a reasonable amount of time, however, you do not find relief from one or more of these self-care measures, you should consult your doctor. Also, answering no to all of the questions in the flowchart may mean you do not have this particular medical condition, but you could have something else with similar signs and symptoms. When in doubt, consult your doctor.
Hi, this is Dr. Don Powell again. I want to thank you for watching this seminar, and hopefully the information that was presented in it, along with your self-care guide, will be of great benefit to you in protecting your most precious resource, your health. Always remember that no one will take better care of you than you. Good luck and be well.